This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945.
Welcome to the Chalk Talk Gym podcast, where we explore insights into healthcare that help uncover new opportunities for growth and success. I'm your host, Jim Jordan. Today's guest is Dr. Ben, a pediatric cardiologist at the University of Iowa who has dedicated his career to clinical excellence, academic medicine, and now physician coaching. After nearly 2 decades in a high-intensity medical environment, Ben hit a professional wall, prompting a powerful personal shift. Rather than walking away from medicine, he chose to reshape his role within it, launching a coaching practice focused on helping fellow physicians navigate burnout, find life balance, and career transformation. In this conversation, we explore how coaching reframes power dynamics, the emotional intelligence gap today in medical training, and how small, intentional changes can make a big difference in your life. Whether you're in healthcare or just navigating your own career inflection point, I think Ben's insights are both practical and inspiring. So Ben, tell me and the audience a little bit more about your journey.
Thanks for having me. My name is Ben. I'm a pediatric cardiologist and a physician coach. How I got here is probably a little bit of a straight story and then a windy story at the end. I was pretty confident that I wanted to go into medicine as soon as I went into college. My path from being a freshman in college to being a resident physician and then later attending at the university hospital was a very linear path. I started pre-med, put my head down, plowed through the required work, went through training and a fellowship in pediatric cardiology, and started my academic position at the University of Iowa and have been at Iowa my entire career. I've discovered that I'm a little of a unicorn and that I've been in the same academic institution for my entire career. I love taking care of my patients. I really like the challenge that my job presented me, both in clinical care and building an academic career. Through circumstances outside of my control and my institution's control, our multidisciplinary program hit a road bump. Several of my colleagues and specialists in our program left. And I looked at leaving at that time. I thought this might be a good opportunity for me to look elsewhere and had some job offers that would have been a promotion in the academic world. But it really wasn't the right decision for me and my family. So I stayed. And the problem with staying was that I kept doing the exact same thing over and over. I put my head down and I gutted it out and doing way more work with fewer resources and hit a wall. And that's when I discovered coaching and evolved into this physician coach mindset.
So how long have you been doing the coaching?
Yeah, so I started training as a coach in 2020 and then started a coaching business in the last 18 months to 2 years.
So how is coaching different from doing rounds with students when you're educating them?
That's a great question. The simplest answer is that when you're an educator at rounds or standing in front of a lecture hall versus when you're a coach, the power dynamic really should be a lot different. So the traditional model of mentorship and education is that the person doing the educating and the person doing the mentoring really holds the power. And the coaching model is that the person being coached holds the power and should guide the discussion and how things move forward. And I guess as I'm saying that, reflecting back, mentorship and teaching should probably act the same way in many settings, but we're not trained to do it that way. And so that shift in mindset was sort of like a light bulb for me.
That's why I asked the question, because it's, as a physician, you're making the decisions, you're leading the clinical decisions for situations. And in this case, you're leading your client to whatever it is you're trying to lead them to, but you're not doing it in a direct way at all.
Correct.
That's interesting. How do you define your role before in the healthcare continuum to how you're interacting with it today?
That's a good question. I would say before I went through this experience and became a coach, I really saw myself a cog in the wheel. I was going to show up, do my job, and when asked to offer solutions or my diagnosis from a physician's point of view, no matter what the scenario was, I think I've learned to be more of a question asker, to ask more questions, and rather than trying to solve every problem, maybe trying to understand and frame the situation in a way that I didn't before.
So how does coaching a physician different than a business? I about this yesterday because I have a part of my practice, it's a coach, and historically, years ago, I was more on the strategy side. And I found myself struggling yesterday talking to the COO because I knew the answer to his problem and I wanted to do the research and serve it up. And that was not my role. My role was to strengthen him and his organization. Physicians generally have an individual component to what they do, and then they have a group component, right? Whereas suppose when we have an emotional component that they're dealing with, which we might define as managing your emotional intelligence, then they have their organization. Is it the same or a different structure coaching physicians?
Great question. I would say that it's similar. The biggest struggle I've noticed coaching physicians is that we learn how to function as healthcare providers. So we learn the clinical skills, the clinical knowledge that we need to interact with patients. And we learn everything else by default. So we're not intentionally taught how to lead a team or how to communicate on a team. There's very little intentional teaching on how to deal with your own emotions in a stressful situation. You learn how to deal with the patient's emotions and how to respond to them, but you don't learn how to respond to your teammates. And so it's really sort of learning, kind of like you hinted at, some of that emotional intelligence, some of that communication flexing when you're on a team that you just don't learn unless you are an intentional observer and pick and choose what you want to use in your own career.
So how did you learn those skills?
I was fortunate in my training in that I had a couple mentors who told me early in my career that I'm there to learn the medicine, but also how to do a job. The reason many medical students and trainees struggle earlier in their career and sometimes even drop out or are asked to leave has very little to do with their knowledge and skills. It has everything to do with how well they work in the system. I heard that enough that I just paid attention to some of those things and watched what people did well. But not everyone gets that message. And I think that's why some people struggle.
I think when we talk about physician shortages and how much administrative burden is coming on physicians, these are the smartest people in the world and can do whatever they want. It's not about the acquisition of knowledge and the ability to process it, but we don't take any time and teach them how to deal with teams or leadership issues or building the team around them. Is that different when you talk to clients that are academic oriented versus private practice?
Yeah, it is. It's very different. I think people in academics use the mindset on people in private practice. We're a little bit squishier. We intentionally go into academics because some of those softer skills and that side of medicine appeals to us. And the people that go into private practice like the, I would say this is a bit of a generalization, but that grind a little bit. And so like the quick turnover in patient care and like the business model, it is a very different mindset.
And they probably appreciate that the team is there for them. And so they have to nurture it and protect it a little bit more than an academic environment where someone else is managing the team.
Exactly. Yeah.
What challenges are you facing with your products and services as you try to attract customers? I mean, it's a little different business model, right?
It's a different business model. As I said before, there's lots of things that physicians don't learn. One of the things I didn't learn was basic business. It's been a trial and error process for me about how to build a business and how much investment do I want to make in myself, my time, and my resources. Along that process, how much of this process do I view as personal growth and how much a business investment? It's learning how to balance all of that, which was completely foreign to me.
So how do you find your clients?
Great question. I do reach out on social media. Now that I've been around for that 2-year mark, I've been posting blogs regularly. Actually, my long form content seems to attract people more than social media posts. Being present has helped attract people from outside my institution and within my institution. Interestingly, it's about that 18-month time frame where people are like, oh, I didn't know you were doing this. Can I talk to you and figure out how we can work together? So I think for me, it was just being persistent in a strategy and showing up every day and keeping a good attitude.
And for your client, what's the moment when they realize that someone like you would be benefit to them? What epiphany are they having that says, you know what, this might be a helpful thing for me?
Yeah. So it depends on their career trajectory a little bit. So recently I've talked to someone who's in their training and they went through medical school a little bit late. And so are essentially not even early career yet, and realizing that there are all these other life milestones that they sort of put on hold. And so one of them was they went to a friend's child's first birthday and I thought, wow, I haven't even thought about starting a family yet. I've been so focused on my training that I forgot about everything else. I worked closely with him and he happened to look at my social media and said, I didn't know you were talking about any of these things. It was a moment in his personal life where he thought, oh, I have a few other identities that I've been neglecting and I want to explore them.
Do you find that there's a common theme among your clients in terms of a prioritization of issues that they're tackling?
Yeah, it depends a little bit on where they're at in their career. One of the clients I'm working with is a later career academic physician who, because of life circumstances, had reset every 5 years and is realizing they have a lot of untapped potential and are recognizing their runway is getting shorter because of where they're at in their career. and just want to make sure that they achieve their professional goals. And so I see a group of people later in career where it's a little bit profession and legacy focused. I'm working with someone who has kids who are 10 and 12, mid-career, and they don't want to miss out on their kids, all the things that are going to happen in their kids' lives in the next 5 to 10 years, realizing that their kids are going to be leaving and maybe want to dial back on their career a little bit and focus on other things. And then there's a group of people who are just starting out who want to avoid all the mistakes that the rest of us made and are trying to figure out how to navigate that in a different way.
Well, that's really interesting because with the physicians that I've dealt with over the years, you just categorize them so beautifully. I've had a few later career friends that have gone to be chief medical officers of Medtronic or one of those. And the realization is I've helped one-on-one all these years now. It's a legacy thing. Now I want to help many or change the practice of what I'm doing. I imagine that the mid-career person and the family balance thing is someone who's quite enlightened, actually. It's really easy to not focus. And so is part of your presenting yourself to the world, getting people like those mid-career people and those younger people to realize that there could be some benefits that they're unaware of?
Yeah, I think a lot of just presenting myself to the world is honestly just telling my story. I hit this wall 10 years into my career. I did everything by the book and did it right, so to speak, and I still crashed and burned. Many people tell that story and the answer is they leave medicine or they kind of blow up their personal life and they make this big, huge change. And that wasn't my story. I was able to make little changes, stay in place, keep my family intact, and keep that part of my life happy. And so I think it's helpful for people to hear that sometimes these small intentional changes wherever you are can have just as big of an impact and be less disruptive.
And so with all that's going on in healthcare, how do you keep current on these rapid changes in the healthcare system and how they impact your clients to be able to merge both things in your conversations with them?
Good question. I try to consume as much information as possible. It just goes back to listening. No matter what changes are happening at a level well above my control, no matter what the circumstances are, I think the day-to-day challenges haven't changed a whole lot in the last 10 to 20 years, right? There's still the basics. People need to make a living. People want to show up to work and be fulfilled at their work. And then they want to have time to do things outside of work. Figuring out how to do those basic things makes the biggest impact, no matter what's going on in the world outside of us that we can't control.
So we were talking earlier of how I got into this, that I've historically been a quant guy, and I realized during some interviews that I was getting some hints of some trends before there was any evidence of it. Are you feeling anything at the moment or hearing anything as you talk to people of something that's shifting in the healthcare world?
It seems to me that physicians as a group have largely been disjointed as a larger body. Healthcare people with the boots on the ground have a voice, and that voice has a little bit of power to determine how things are done, which is a little bit unique, an individualistic profession. And I think that mindset may be shifting a little bit.
And do you think with the younger generation coming through, is there a different culture to that generation than if you look at the baby boomers, they had the 80 hours of residency and all this, and there's been a lot of law changes accordingly and appropriately, but also some people wanting a little more balance in their life. What's the differences in your opinion?
Yeah, I think you nailed it right there. The interesting thing is, I hear the older generation, my generation included, bemoaning the fact that the trainees don't want to work hard. That's actually not true. The people coming into medicine have the exact same work ethic that we have all had. Everyone that entered medical school knows that's a challenging path. It's just that they want to do it differently when they want to prioritize things outside of medicine. And my hope is that I can use that drive to make changes and still show up and be really effective healthcare providers.
My primary care physician resigned. She just had her third child, and she was the best primary care physician I've ever had. Today we have the app, so when they're filling out the electronic health record, you can actually see that they're doing it, right? It's 9:30 at night, 10 at night, I see her doing this, and I realize she's got an 8, a 6, and a newborn. I guess it didn't surprise me that she said it was too much. My visits with her are a little healthcare nerdy, and so we were just talking about why she's making the change. With her credentials, she anticipates that she could take a couple of years off and come back, which you can't do that in a lot of professions. So what's the biggest lesson you've learned in your journey thus far?
Good question. I think it's really that those small changes make a big difference. And that's something that pops up in my head every day. And I remind myself every day. Sometimes it's something as simple as just, for me, I sit in a workroom and I read echocardiograms. So there are 40 to 60 studies that just come across my desk. And it's very easy to sit at that desk all day and not leave because you don't want to get behind. But taking a 15-minute break at noontime makes a big difference, and it doesn't affect. I actually get out of work earlier when I take that 15-minute break. So just recognizing that small changes in your day can have a big impact is something that I remind myself and my clients all the time.
Yeah, I'm finding that sometimes leaving some space opens up creativity and solves problems fast than just keep running on the treadmill.
Absolutely.
What's the biggest opportunities and threats that you see, particularly to physicians over the coming decade?
Yeah. I think the biggest threat probably is the business model, to be quite honest. I don't think it's a sustainable model where costs are rising and reimbursement is decreasing. That feels like a sinking ship, to be quite honest. Similarly, I think that's also the biggest opportunity because there are healthcare system models where other countries or institutions within the US have found a different way to practice. It focuses more on provider well-being and patient satisfaction in a way that it's not just a survey that people look at to judge you, but in a way to make meaningful change in the healthcare system. So I also think that's the biggest opportunity.
Yeah. And what do you think is the threat? Probably the same thing. But I mean,
Yeah, I think it's cost and reimbursement. I think it's how we think about healthcare as a commodity, and we need to condition that a little bit.
and maybe move the money around.
Exactly. Yes. Yes.
GPOs and pharmacy benefit groups and all the middlemen that exist. If you were looking at lean manufacturing, you would call them non-value added, right?
Yes.
And it's not to disrespect what they do. The concept of non-value added was if you're not touching the patient or if you're not directly involved in the care, then you're not delivering the core. The goal of the system is that's where you focus most of your money and effort, and you try to reduce everything else. Sometimes it seems to me we're going in the other direction.
I agree.
Was there anything else you'd like to share with the audience?
I would love if people are curious about what physician coaching is, even just what are you talking about? What are physicians struggling with? I've got a blog that talks about a lot of these things. Check out my website, thedevelopingdoctor.com, to just get an idea of the day-to-day struggles of a healthcare provider. If you happen to be a healthcare provider who's struggling, I'd love to talk to you and see if we can help you out.
Very good. Anything else?
No, thank you so much.
Thanks for tuning in to the Chalk Talk Gym podcast. For resources, show notes, and ways to get in touch, visit us at chalktalkgym.com.
This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945.